My next guest here in the studio is Julia, and I will let her introduce herself. She's a new face at the Winnebago County Health Department, but definitely not to Winnebago County.
Yes, hi. Well, thank you for having me here. My name is Julia Salomon, and I recently joined the staff of the Winnebago County Health Department about 7 months ago. Prior to that, I was working as a community health improvement leader with Ascension, Wisconsin, formerly known as Affinity Health System. And then prior to that, I also worked for about 6 or 7 years with the University of Wisconsin Extension. I've been working on a lot of public health projects, and finally I get to say, bona fide, I am part of public health department as a public health planner.
Right, so it kind of seems like all of your previous jobs kind of led you up to be this public health planner. At our health department, can you tell them a little bit about what a public health planner is?
Sure. I primarily assist the different divisions in the public health department. I prioritize, strategize, evaluate the excellent work they already do. So I help them facilitate using evidence-based practices and results-based processes how to have a greater impact on the health outcomes of the community we serve in Winnebago County.
Yes, and it's been a great addition. Our staff is growing, and it's good to have you to take that critical eye. That's kind of a little short glimpse at internal, but external, I know that you do just as much. Can you kind of talk on that?
Sure. So first of all, I'm not the only person on staff that works with the community. There are some excellent staff members in our department that have been working with the community, with coalitions or groups who work on addressing particular health issues in the community. And again, I just lend my facilitation skills to help the coalitions and our staff members work collaboratively with the community.
Right, so that's kind of like the day-to-day. There are some bigger overarching projects that maybe aren't happening every year. Can you talk about a few of those?
Sure. So to get a better pulse of what the community is dealing with in terms of health needs, every 5 years, public health departments go through a process called community health assessment. And interestingly enough, healthcare systems in our area also have a similar requirement. Theirs is on a 3-year basis. So we've decided to work better together as opposed to work separately in silos. So we have combined with two other counties, and we have a tri-county Fox Valley Community Health Improvement Coalition, and it brings together 4 different healthcare systems and 5 different public health entities, and we work together to do the data collection together. We share costs together, and we get a better sense of what the community itself identifies as their perceived health needs. So it's really a community-led effort, and we're just one of those participants, and it's worked out very well working in collaboration.
Right, if you're all doing the same work, might as well be doing it together.
Excellent point.
So, it makes sense that hospitals have to do this, and there's been a lot of changes since the ACA law has come into play and all of that. Why is it important that public health is at the table or, a leader in this?
Right. So a lot of people think of public health as just disease or chronic disease or preventing disease, but there really is a lot more room for public health to be at that table. So for example, let's pick transportation, right? A lot of people think, well, transportation, you take the bus, to go to school or go to work. But what about taking the bus to go to your doctor? Or what about WIC recipients who are coming to our office for the much needed benefits that they receive? How are they getting those services? So when we talk about transportation, the public health department really takes a bird's eye view and says, well, what are the issues affecting access? And access to health, access to clinics, access to doctors. And so all of a sudden it does become a public health issue.
Interesting. So how I mean, it's kind of obvious when you're part of these coalitions that are very health basic, but how do you get on the table of a transportation issue? I mean, how are you breaking those doors down?
Sure. So community work takes a lot of trust, a lot of open communication. Our community members know the excellent work that our department does already. So I cannot take credit for opening those doors, but it's through open and honest conversation. It's through not having turf issues and saying, we're in this together. We want to solve this together. We want to be a leader together in solving some of these issues, or at least addressing them, and hopefully showing impact and improvement in health outcomes. So even, for example, how we use the land in our communities, land use decisions. Well, there are public health implications there. So we sometimes ask, hey, have you thought about the public health implications in your land use decisions? No? Let me tell you a little bit more how we can be a really good collaborative partner. And so really it's all about trust and open communication.
So some of the partnerships that you're really working on now or have already been established, I know that they're doing some really neat things with the Oshkosh School District, a lot of the school districts around here, and mental health. Can you talk about any of those that you're really trying to beef up or that surprised you since you came?
Sure. So for example, going back to that community health improvement plan that we do, we identified about 5 different public health or community health priorities. Actually, when I say we, I mean the community. And mental health and access to mental health was one of them. And when we look at all aspects of mental health, we look at mental health in the adult population, mental health in youth, and we have heard that the youth are really struggling, whether it's the presence of social media or the pressures of just going through adolescence or whatever. And so we take a look and say, okay, what are some things, or who are those partners that we can work together to really dig deeper into what is going on with issues of mental health in our youth? And so an obvious partner, of course, when you talk about youth, are our schools. And our schools have been such a wonderful partner in helping us collect the data, analyze the data, and really be a partner in improving those health outcomes for our youth.
Right. It's such an obvious example, but there is sometimes some big red tape to cross, and it's really nice to see everybody working together in this county, and I'm very surprised at the wonderful relationships that go on there. So kudos to the community members, and may it keep going so that we can get more done. As you're sitting out there, you might be thinking, well, we're working on this project, we're doing some strategic planning, but we don't have health at the table. So Julia is a great person to start that conversation with, to contact the health department and see what isn't being considered, what other types of funding might be available, there's so many things that public health can touch on, and we have a great knowledge base with all of our staff. So go ahead and contact Julia. Why don't you share with them your email and your phone number?
Sure, it's a long email. It's jsalomon@co.winnebago.wi.us, and it's probably on your screen. My number is 920-232-3038.
And we'll leave that up there on the screen for a little while so that you can jot that down. Thank you again, Julia, for stopping in and talking about this. It's a big concept, a big concern, but something that maybe we don't always stop to think about. What's the end goal? Where are we headed with this? And it's nice to have you take that critical eye and really help staff get to where they want to be.
Well, thank you very much.